Okay, I'll just take a few minutes today and do kind of a bloggy thing. I wanted to talk a little bit about sleep disordered breathing. I think this is an issue that affects millions and millions of people. Probably most of the people that are watching this at some level or another have some degree of sleep disordered breathing. And it really is kind of a disease of aging. One of the things that happens, and we're going to look at the airway from front to back, as we get older, everything sags, okay? Usually the older we get, the fatter we get, the more problem we have with breathing. And so obviously none of us are getting any younger, and a lot of us are at least staying the same, if not gaining a little bit of weight. But as we sag, everything tends to close off. And one of the things that happens even in the face is your mid-face tends to sag as we get older. It pulls down and it obstructs the opening of the nasal valve. The blood vessels inside the turbinates don't function like they did when we were younger, coinciding with sort of small vessel disease that happens as we get older. The turbinates will tend to be dilated. The nasal cavity will be more obstructed and full. And when your nose is obstructed, you can't breathe well through your nose, and it has the tendency to collapse the palate and the tongue base. The palate, when you snore and suck on it every night as you're obstructing, you're literally sucking on the uvula and the palate, stretching them out. And over time, the uvula and palate become elongated. And probably some of the people watching this video have woken up in the morning and their uvula is real swollen and funny because they sucked on it all night. And then the last area where people obstruct is the tongue base. As the tongue base falls back, it blocks our breathing. Well, what happens physiologically when this occurs is that the oxygen level in our blood goes down. When the oxygen level goes down, your brain says, oh no, we're dying. Wake up, take a breath. Well, as that happens, your body's releasing all these stress chemicals, epinephrine and norepinephrine. Those chemicals have the tendency of increasing your blood pressure, make you sweat, and they don't allow you to get into those deep phases of sleep. Those deep phases of sleep are important for a number of reasons. One is sleep consolidation. It's good for storing the memories that you've formed during the day. It's healthy to allow the brain to be able to rest. And when the brain doesn't get that opportunity, when it's being stimulated with catecholamines and it's under stress, the chemicals that it releases are not the same. For example, growth hormone secretion, cortisol secretion, testosterone, estrogen secretion, all of them are tied to our sleep patterns. And if our sleep patterns are disrupted, your entire physiology isn't functioning normally. And so it really tends to be a factor as we get older for people where these, the secretion of these hormones are very important for our overall health and well-being. The other thing that happens that is really problematic is that when your lungs are starved for oxygen, the blood vessels squeeze down. And they do this in an attempt to not send blood to an unoxygenated portion of the lung, which works great if you have a pneumonia, but it doesn't work great if the entire lung has low oxygen. All of the blood vessels in the lung become tight, and it forces the heart to beat very hard to try to push that blood through the lungs. So that combination of elevated blood pressure, increased cardiac stress, lack of appropriate sleep, you're not secreting chemicals appropriately, you feel fatigued, you're trying to search for words during the day, you're less motivated to go to the gym, your leptin and ghrelin levels are out of whack, and so you tend to be hungrier, and it kind of contributes to this, what we used to call a syndrome X, which is obstructive sleep apnea, hypertension, diabetes, that whole phenomenon. It sort of starts the ball rolling. And so one of the important things is to get in front of that ball and to keep it from snowballing. And it's especially important for people maybe in their late 20s, early 30s as this process starts to happen, and then on to late 30s, early 40s and 50s. Now it becomes really important. So I guess, what I'm trying to do for people today is just kind of make people aware of the condition, because I find that when I talk to people in my clinical practice, people are reluctant kind of to focus on sleep because they sleep and I snore and I bother my wife, and I tell them, well, no, this is unhealthy for you, and people, they don't always believe it. And so I just kind of, almost as a community service, I want people to kind of recognize that this is an issue. If you think that you're having trouble breathing, or your spouse or your child are having trouble breathing, it really is an important issue. And today I'm mostly focusing on longevity, but in children it's especially important too. If they're not sleeping well, it can affect their cognitive ability, even lead to delay, and a decent percentage of kids have ADHD, or difficulty focusing during the day because of their attention span. So it affects adults and children differently, but suffice it to say that it's a serious disorder. It tends to get worse as we age. Again, it's related to hypertension, diabetes, stroke. diet problems, exercise, and just overall longevity. You're much more likely to have strokes and cardiovascular events when your body is in a stressful situation. So anyway, this thing to focus on when you go talk to your primary care doctor, or if you're so inclined, come see me. We can help you with a lot of these. And it's a complicated issue and a thing that I can usually unravel pretty well for people. Don't forget that in some folks, it may also affect their balance and their blood pressure during the day, where you can get lightheaded. So anyway, lots of issues. Go see your doctor or come see me or John. Have a good day.